Hey, Jess, what are you reading there? What do you got?
Oh, this little piece of work is my 2021 rate and benefits update from Kaiser Permanente on my covered California exchange plan. And guess what? Those rates, they're going up 10%.
Well, Jess, come on, be reasonable. They only made 3.3 billion in profit the first half of this year compared to the 2.7% they made for the first half of last year. And that's only about 9% of total revenue. So if they're going to make it to 10% profit, you've got to chip in.
What?
You don't think you
My
should?
10%? Wait a minute. I don't understand how they're. No.
No?
No.
No.
I'm so mad. I'm so mad about this. 10%.
So we're going to have Jess being mad on the October 29th episode of Health in 2.0.
Why do I have to be the face of hate? This is legit bullshit. I expected much better from Kaiser. Usually they're so amazing, disruptive, blah, blah, blah. Not happy at all. We need to disrupt this stuff fast enough. People come on.
I must admit, I don't understand it because Kaiser as the health plan, right? Their profits have gone up because fewer and fewer people are using stuff. So they're estimating that more people are going to use more services next year already. I mean, it doesn't make a lot of sense.
Now that they're charging me more, I'm like, I gotta get my money's worth out of this shit. Absolutely, I'm gonna go.
All right. Well,
what's happening? Oh, okay. Why does this?
All right. I think you might need some care, and maybe we'll find some deals that are going to provide.
Oh my God, you should feel my blood pressure right now. Truly,
Maybe there's a wearable we can help you with.
How about we start there? Where's your little timer? Ready?
Okay.
Oh my God, people, disrupt this now.
Go.
Here we go. All right. Whoop. There it is. Gets 100 million. Valuing the company at 1.2 billion. SoftBank money is in this, along with IVP. They led it, and some athletes too. This is a wearable. How is this different, Matthew Holt?
So this is not, they don't charge you for the wearable, but they charge you $30 a month for the thing. And then they tell you all this data about your health and blah, blah, blah. It's like a band. It's a band that goes around your wrist. You could use it. And it's got Eli Manning and Patrick Mahomes and a bunch of NFL folks who are all in this. The thing that worries me about this is, what is this different from Fitbit? Which
I don't know.
It's got sold for $2 billion. And
it's locked in the basement of Google somewhere.
Well, it hasn't yet been onto the basement of Google, but we'll see. But maybe, it's certainly those pro athletes, weekend warrior types are really lapping this up. So,
all right. What about Honor? They get 140 million in a Series D. That brings their total up to 255 million. Tell me about this.
Yeah, so they've been around a while. Seth Sternberg's the CEO. He's been he was at Health 2.0 back in 2014 when he was getting this together. And it started out as being, can we build like an Uber where we're going to match its home care? Can we match homemade nurses with people who need them? And they found out that business model didn't really work, but instead, and people thought they might be on their way out, but they raised a bunch more. Apparently they were going to raise SoftBank money and didn't get any earlier this year. But then they've just got this new round because they are selling their technology to other home healthcare agencies.
Oh, that's cool.
So, maybe it's a pivot, but it's a vote of confidence.
All right. This will get your blood pressure up. A DTX company, Sidekick Health. They get 20 million. This is a gamified medication management platform. We've got big deals with Pfizer and Bayer, right?
Yeah, they've got a bunch of stuff for IBD and others. It's but selling direct to drug companies, probably a way of making some money, but not a way of getting very rich. But 20 million, maybe enough.
All right, some telehealth, SaaS telehealth platform, eVisit gets 14 million. What is this? How is this different?
It's not.
Okay. And then what about Cricket Health?
You get that.
I love that. How are they different? It's not.
Get on the cricket then.
You're jaded and I'm angry. We finally hit that point. Oh my God. Welcome to Q4, people. Okay, so Cricket Health, complex kidney disease. What are they doing that is unique and new to disrupt
another one I'm highly connected to because it not only launched at Health 2.0, but actually the former CEO, Arvind Rajan, who just kicked himself upstairs to become executive chairman because he doesn't want to work that hard. Yeah, was my roommate back in the 90s. So I know them pretty well. Interesting space. There are 4 or 5 companies in this space of like managing kidney disease, which has been a lot of the news in California because we have this proposition that's on the ballot about, the big guys doing dialysis, and we have companies like Outset Medical, which is doing now home dialysis. Cricket is one of a number of companies which is trying to figure out how to manage people before they get to the point where their kidneys collapse and need dialysis. And doing, try and get, and they've done some deals. I think they've got a deal with Blue Shield of California and some others. I can't exactly remember who. It was a bit odd because it's a $15 million debt round. They'd already raised a bunch of money from Oak. I mean, they'd raised a lot more in the past. So I did actually ping Arvin, and he told me that this is just going to help them get to the next round. But basically what's going on here is they have got a bunch of clients they're already out with, and they need a bit more cash just to, but they've still got a bunch of their initial money around. Kidney disease is highly complex in the way that we manage it, because Medicare takes over for dialysis. And at what point you become eligible for that and not, and who's going to manage it between the private plans versus Medicare and Australia, it's definitely going to change. Even the Trump administration has done some announcements about changing kidney disease. So interesting. It's a bit of a weird round for cricket, but hopefully it's going to do well, because that is an area that needs a lot of innovation.
Absolutely. We just saw Outset Medical go IPO. They have that dialysis device that people can use in the home.
Yeah, but that's not even available yet, right? So that's kind of like a more like a biotech thing. It's coming. But the thing is, can we get to people as they get down the path towards kidney disease and do something about it and interrupt, that progression? Because once you get on dialysis, things are pretty grim.
Got to cut those healthcare costs, otherwise they just jack those premiums up.
You go for dialysis now? No, you're Medicare.
I'm just speaking generally. No, but I think kidney care obviously is something that needs to be improved. Awful, very invasive. Anyway. Well, if you have any health plan ideas, please feel free to tweet those at me at Jess and Matthew. And if you'd like to talk more about, I don't know, what are you talking about these days over on Twitter? You're causing all sorts of trouble. You've been punchy on Twitter.
Well, I mean,
it's like next level as we ramp up towards the election.
We've got to realize that now we have another conservative in the Supreme Court. There may not be a California exchange for you to buy Kaiser on by next year if they're going to see the ACA. So we'll see how that.
I don't know what I'm going to do. I mean, this puts me in a difficult situation, I'll tell you that. But follow him on Twitter and hear more about the policy side of this, because he is very, very educated and well-read on that, and also very opinionated. So he is at Bolty-Boy if you like those things. And if you want to just stay out of the fray, or you want some other perspectives, why not sign up for our email newsletter over on thehealthcareblog.com. We curate the best content from the blog, put it in there, send it to you once a week. Lots of different opinions from lots of folks that are not us. Although we're in there too, these cute little Health in 2.0 episodes and my WTF Health interviews. Mr. Holt.
Mr. Master.
Oh my God. It's truly like blood pressure, sky high right now.
So basically what you're saying is that Kaiser putting up your premium is going to increase your healthcare usage.
My blood pressure directly correlates with the increase in this premium payment.
Oh, well.
All right, we'll leave it there. See you later, guys. Take care.